Good evening, everybody. Welcome to Dialing Down Your Handpiece by Procedure during COVID-19. I don't think I ever thought in my lifetime that I would put webinars together based on a pandemic or a global problem. But it seems that the webinars I've done lately have all had some sort of a COVID theme. This is week number 10 or so for me that I've not been practicing. And I will tell you that last Friday, I kind of hit the wall a little bit. Friday was, I'm in New York, cases are still pretty high. The governor's doing a great job, but, I got a lot of patients, and my patients want care. And it was confounded by the fact that today, physicians, dermatologists, plastic surgeons were able to open. So we had a good number of people call the office asking for appointments, not understanding why we couldn't take care of them. And it was a hard day answering those patients today. I mean, we try to explain to them that we're ready to go, and we'll talk about some of the changes that I made in my practice going forward and some things that you could incorporate, but also explain to them that the government is holding us back at this point. And when they think it's safe, which is the strangest thing in the world, when they think it's safe, it's going to be safe for us to open our doors. So everything I'm going to show you today are products, procedures, techniques that we use in our office day to day. Not in the last 10 weeks, but day to day before and day to day after. I want to thank NSK for graciously supporting this program. I also like friends, and many of you are my friends on Instagram, but feel free to friend me at Vino Dentino, where I show some dental procedures mixed in with some great Napa wine. So at Vino Dentino, and for those that love wine, tomorrow night on my Facebook Live, and at Adamo Elvis, for those that know Adamo, on Instagram, we're going to be featuring a winemaker from Napa Valley and have a great 1 hour. That's 7 o'clock Eastern, 4 o'clock Pacific on my Facebook Live or at Adamo Elvis on Instagram. But this is my Insta, and you can feel free to friend me here as well. So let's talk about what we're going to do tonight. Our goals: discuss some relevant changes to our offices post-COVID. We're going to review adjusting our technology to meet current needs, and I'll give you a few tips and tricks to make the day go a little bit smoother, because God knows going forward, probably the most important thing we're all going to want is our days to go smoother. So let's talk about change. And the question is, are we, or how are we changing post-COVID-19? So for many of you in about 40 states, you are able to go back to work, at least in some form. Emergencies or urgent care at a minimum. Here in New York, I'm limited to only emergencies right now. And really, they really draw the line there. But before we got there, we decided we were going to institute a bunch of changes into our practice. Now, I have to preface this with the fact that while I don't minimize the extent of virulence of COVID-19, I also have a firm understanding of how safe we have been as dentists over the last years we've been in practice. So we've always used universal precautions: gloves, loupes, shields maybe, masks. And if you think about our medical counterparts, most medical doctors don't use any of those things. They don't even wipe down a room. I'm sure that's going to change post-COVID, but we were already doing these things. So I can make a contention that the dental office, despite all the information out there about aerosol being unsafe, I can make a contention that with a little bit of change, the dental office might be the safest place out of any of the medical professions that are out there. And we'll talk about some of those things and changes. So what are some of the things that we did in the office? Again, we always had a safe workplace. And I think when we talk safe workplace, we talk safe workplace for our patients, but also for our team. I follow a lot of the internet threads, of course, not all of them because there are so many of them. And one of the common themes I see is a lot of negativity on the hygiene boards and the hygiene threads. And if you're around next week, you can join me from my webinar and we're going to talk hygiene. But the point is, for me to make things safer, it really was safer for my patients as well as my team. That involved making some minor changes in the substructure of the office. It's also going to include some screening for our patients, maybe some testing, and then treating things maybe a little bit differently as we go forward. So how do we make the workplace safer? Well, the first thing, you probably saw a ton of information all over the place on how we needed to do something about the aerosol. Do something with the aerosol, treat the air, absorb more of the spray. And many of you probably have purchased those large elephant nose external suction units. Maybe some of you are regretting that purchase already. But that was one option that was proposed to people. Another option was treating the air, actually doing something to treat the air in the office. Another would be using rubber dam more often. And then maybe changing or adding suctions into what we do. Anything to reduce the aerosol. I guess we have some decisions to make. Are we going to treat the rooms? Are we going to treat the office? Are we going to treat both? Or are we going to say, we've been good for a long time. I don't remember any of my team members getting sick from a patient. I'm not going to do anything. I'm not advocating that, but I'm sure some people have done that or are thinking that. So after doing a bunch of research, we decided to treat initially the workspace, the entire workplace. By installing something into the HV system, we're able to treat the entire space, which will also treat our rooms, and everything will work at the same time. This is a product called the Aris Air Scrubber. It was developed in conjunction with NASA, and it was installed by my HVAC guy into our HVAC system. One of the key things for me was there were no filters. This is a device that scrubs the air with UV. So air comes in, it scrubs it with UV, and then spits out hydroxyl ions, and those ions kill viruses, kill bacteria, remove dust, pollen if you had that in your home, or any of these other things. The Aris Air Scrubber, in combination with UV light, is able to kill all of these. Now, was it tested on COVID-19? No. But it was tested on all of these, and it did a great job. So what it shows you that in a couple of hours, you get about 80% kill and microbe reduction, if you will, in the space. In 24 hours, you get 100%. So this is a device that works behind the scenes in your HVAC, and it's constantly working. As long as the air is circulating, air is passing through this, and those friendly free radicals are released into the air, killing the bacteria. Another study that was done at the University of Cincinnati showed that with this technology, the percent of reduction of airborne pathogens was basically 90% in 20 or 25 minutes versus next to nothing with your regular HVAC. So if nothing else, this is an improvement over what we had. Is it the best? I can't say that. Is it going to kill everything? I can't say that. Will it make my staff and patients feel more comfortable once I present this to them, which I did, and the answer was yes. It's not terribly expensive. We'll run you about $1,200, or depending what they'll charge you, $900 to $1,200 installed, and one unit can cover about 2,500 to 3,000 square feet. So depending on the size of your office and how many zones you have, you may have to add units. We actually put 2 in our house as well. What about these external suctions? I'm not saying they're good or bad. They didn't work for us. And the reason they don't work for us is twofold. Number one, they really have to be close to the patient in order to grab a lot of that ambient aerosol. That's going to interfere or potentially interfere with four-handed dentistry. Many of these do not have a UV filter on the inside or UV light to kill the bacteria on the inside, which would mean then someone's got to change a filter. Ain't gonna be me. I don't think my staff's gonna want to change it. And that's for the same reason we didn't install plexiglass in front of our front desk. Someone's got to wipe the spit down from those things. And nobody's gonna want to do it. So we decided for our front desk team, they're gonna wear masks and they're gonna have universal precautions. And us in the back, we're going to do what we always did, use our high-speed evacuation, but potentially add some other things other than this. I pulled this from a recent study, and I think this was a very powerful 4 lines I pulled from the study. And it said that saliva might contain the virus in roughly 80% of the cases where nasopharyngeal swabs were used, but with a median cycle threshold 30 to 40% higher than in nasopharyngeal swab specimens. The higher the cycle threshold, the lower the viral load. So while it was in saliva, there was a much higher cycle threshold, therefore a lower viral load. I'm not saying you can't get sick from salivary aerosol. I'm just saying let's look at some facts. That there's much less of a viral load in the saliva. You can add on auxiliary types of suctions. This is a product we bought for our hygiene team. And when they start working, even though they're going to do a lot of hand scaling, we will incorporate this. And it's a product called Zuction. And Zuction is a wide mouth suction built into a cheek retractor. The cheek retractor portion is not autoclavable, but this red piece in the middle is. And I tried getting the video for you guys. I could not rip the video from the internet, but if you go to Zuction.com and look at the video, they claim in grabbing about 90% of the aerosol in using this device. Now, if we can reduce 90% of the aerosol for our hygienists, then selectively, we might be okay with them using their piezos when needed. Because again, we'll talk hygiene next week, but our hygienists need to be able to do a great job. My concern is, and I've spoken about this with a few key opinion leaders, is that with all the extra PPE, with all the extra stringencies put upon us and the hygienists, the care will compromise. And we cannot have care be compromised to any extent. So we've added that type of a suction, and we can use that as a doctor, and we can use that for hygiene. The next thing we're going to do to minimize risk is we're going to screen. We're going to screen all our patients coming in, and we've created a form that will at least rule out for us many of the potential current exposures, meaning if they have any kind of a symptom, they'll be gone. We're not going to treat that day. If they answer yes to any of my questions, it'll require more questions, and we may not treat that day. And I'll show you those questions in a second. We'll take everybody's temperature. If you see, that's going to become the new norm. Apple announced today they're opening up 35 or 40 stores. Everybody must wear masks and gloves in the store. If you don't have them, Apple will supply it. and everybody gets their temperature taken before they walk through the door. So we got one of those forehead thermometers. We got it from a company called Metadenta, and it's a forehead thermometer that'll give us a quick read. And I think the ADA actually has a suggested form to actually record patients' names and temperature. We'll actually put it in their chart, type it into their chart or put it into their chart. Now, these devices typically run a little bit low. So if a patient comes in and they test 99 with these forehead thermometers, they're likely not going to be seen that day because they probably have something closer to 100 or over 100. And again, while that's not real temperature, it's not the norm, and therefore, bye-bye. At least for the next short time, that's the way we're going to do what we do. Here's our questionnaire. And everything is designed to be in the last 21 days. Why? Because very simply, people 3 weeks post-exposure can still show positive COVID. So the questions are, have you been exposed to COVID in the past 21 days? Have you been diagnosed with COVID-19 in the past 21 days? Have you lost your sense or taste or smell in the past 21 days? Have you had a fever in the last 21 days? Have you had a dry cough in the last 21 days? Have you visited or been in a hospital or a skilled nursing facility in the last 21 days? I understand now you can't go to a skilled nursing facility, but in August you'll be able to. And if you have a parent there and you visited them on the weekend, I want to know. Have you traveled outside the United States or out of the state in the last 21 days? And do you practice social distancing? The last question is, do you have antibodies? All of these questions for me are important. Now, if they answered yes to any of these questions, they're going to have one of two options. They're going to either have to reschedule for another 7 to 10 days. I'll explain to you why in a second. Or they're going to have to get tested. Now, why did I pick 21 days? Well, because many people are still shedding virus 21 days post. And I used my office manager as the example. She had the virus 21 days post-symptom. She went and got tested with nasal swab and still came out positive. 4 weeks post, she was tested and she was negative. So what we don't know is at 21 days, is she shedding virus that's virulent? We don't know that. But I can't risk the team. And I would also try to educate that patient saying, hey, you know what, in the last 21 days, you could still be positive because a lot of people don't know. And I would suggest that you avoid contact with elderly people and many of your friends until you know for sure that you're 4 to 5 weeks post COVID-19. In states that are allowed, you can actually test your patients. There's a company in Texas called Microgen DX. It's a salivary test. You can actually test your patients if you're allowed, and if you have what we call a CLIA permit. Please check your state laws on this. I believe all states need a CLIA permit. I learned that recently. In order to do these tests, it's a simple application with a fee. It's nothing crazy. Because COVID-19 tests are what's called a CLIA waived test, a CLIA waived test, and dentists in most states can do those tests. Please check with your state laws, but CLIA permit will likely be intact. The Microgen DX test is a positive negative test. It has nothing to do with antibodies. It just tells you, do you have virus or not, and it's not an immediate test. It's a 24 to 48 hour result. Antibody tests have come under strict scrutiny. And these tests, depending on whose test it is, are showing a range of specificity between 65 and 90%. So they're imperfect tests. That being said, if you get a good one of these, meaning a good company of these, and you're willing to do testing if you're allowed, as a dentist, we don't really care if they have antibodies. I'm not here to assure them if they have antibodies or not. But if they're spewing virus and it just so happens to show up on this test, and I'm allowed to do this test, then I'm all for it. This is an immediate test. It's a 10-minute test. So there's a potential, it's a potential way for you to screen patients in the office. So really, if we're going to test anybody, and New York hasn't passed laws yet, so I don't know that I can, but I will be getting tests if I can. I'm really looking for IgM. The IgM means they're spewing virus. The patient wants to know this. They want to know if they have antibodies. I want to know if they're shedding virus. That's what I want to know, because that's what could infect me or my team. Sorry, a little bit selfish there. Now the visit. Well, the visit, the goal is to minimize aerosol. I mean, when you hear that, as a dentist, you're like, are you kidding me? How are you going to minimize aerosol? What we do is aerosol ridden. So I don't think we can eliminate aerosol, especially as we want to balance ideal treatment with aerosol elimination. But we could find ways to do certain procedures in slightly different ways to reduce some aerosol and use certain burrs with certain speeds in order to remove decay or do other things without any aerosol at all. Or I should say wet aerosol. So first things first, my office is equipped with NSK air-driven and NSK electric handpieces. One of the things I called up Colin Rogers, the president of NSK, and I said, hey, what if I put peroxide in a 1/3 to 2/3 ratio in the bottles in my rooms? Will it do damage to my lines with my handpieces? And he told me they should not do any damage to their lines or handpieces. What's unique to the NSK handpiece is this clean head, so to speak, attribute. When we stop a drill, when we stop a high speed, by releasing the rheostat, the turbine continues to rotate for a second or even two before coming to a stop. And that minor rotation creates a suction force around the head of the handpiece. That's how infectious viruses, along with foreign debris, blood, saliva, can be drawn into both air and water lines. And without an effective infection control system, these viruses can be contagious onto the next patient. Yes, you're going to sterilize these handpieces. I would hope you would. But still, if I could avoid getting this kind of schmutz, as we say, in there, then why would I not want to try? Well, here's what's unique about NSK. NSK handpieces are built with what's called the clean head system. It's a special mechanism designed to automatically prevent the entry of oral fluids and other contaminants into the handpiece. That'll prolong the life of the bearing. So that's in 100% of their air-driven high speeds, 100% of their electric high speeds, and 100% of their slow speed nose cones. So if you think about that, the air water comes out, but there's no suck back going back into that handpiece. So yes, you're going to sterilize it, but you're still not going to have potential contagion locked up into this head of that handpiece. There's also a non-retraction valve that's built into the handpiece. That non-retraction valve at the base is in the coupler base. It's in 100% of couplers and 100% of the electric micromotors. So in combination with the clean head system, that non-retraction valve acts as an effective method to reduce possible internal contamination. We're going to autoclave this, but why have entrance of these types of viruses, bacteria, blood, anything else into the system if you have a system that is built in already to avoid all these problems? And that's the beauty of NSK, besides they're great handpieces. Now, peroxide is an important, or potentially an important piece to us fighting COVID-19. Here's what we do know, and this is from the ADA interim guideline. The use of 1.5% hydrogen peroxide or 2% providone iodine as a pre-procedural mouth rinse can help reduce viral or viral count in the mouth. While there's nothing against SARS-CoV-2, it's generally believed to reduce the number of oral bacteria. Since COVID is vulnerable to oxidation, a pre-procedural mouth rinse containing oxidative agents such as 1% hydrogen peroxide or 2% proidone iodine is recommended for the purpose of reducing the salivary load. So think about this. I've put 1/3 peroxide with water in the bottles in my operatories. All patients now will have to rinse with hydrogen peroxide prior to treatment. I got peroxide coming out of my handpieces. Patients are rinsing with peroxide before. Now, before you ask me, I'll answer it. What happens if they swallow some peroxide coming out of the handpiece? Nothing. There is no problem if you swallow some peroxide. So here we're potentially reducing the virulent agents. Now, for those that have heard me speak before, and you'll hear me talk about it next week in hygiene, so I won't spend a lot of time on it tonight. But for those that have heard me speak before, you've heard me speak about Perio Protect as an adjunct to our perio maintenance programs in our practice. Perio Protect is a company that makes perio trays, which are custom made for each patient. In those trays goes a peroxide-based gel, and that patient wears the trays with the gel as an adjunct to their soft tissue management or to the scaling and root planing in the practice. The trays, because they're made in such a precise way, can deliver this gel up to 9 millimeters in the mouth. So for anyone using Perio Protect, and if they have those trays, just have them wear the tray on the way into the office, because that's extra peroxide you're going to get in the oral cavity. This is what the Perio gel looks like from Perio Protect. It's a 1% hydrogen peroxide gel. The ADA recommends 1 minute. You can have them brush with this stuff. You can have them place it in the tray if they have this. Or if you have these in the office, you don't want them rinsing, they can brush with this prior to treatment, because the substantivity of the gel is what's going to make things even stick a little bit stronger. Here's what the trays look like, these prescription trays. And you have a couple of options. They can rinse with peroxide. They can brush their teeth with the gel. And then you can go ahead and do your dental procedures with your universal precaution and any additional PPE that you think is important. So I want to spend some time in talking about electrics. And I know what some of you are thinking. Cameron is talking about electrics. I have air driven, and he wants me to spend money on electrics. I don't want you to spend money on electrics. I think you should all have electrics in the office, because I think for crown and bridge type procedures, there's nothing like an electric. And once you go electric, you never go back. But I think that you see the growth of the handpiece market and the growth of the electric market from 14 all the way to 17. So people are getting the message, as electrics have doubled in sales since 2014. Why electrics? Why would I want to change? I got handpieces, I got cheap ones, expensive ones. Why would I want to change? What do handpieces am I looking for? I'm looking for more power. I'm looking for more torque. I'm looking for less noise. I want something that's going to be very efficient. I want the right speed for each procedure. Precision is really, really critical. Versatility would be nice. Something that wasn't so heavy would be ideal. Something that's just very light, that's going to make things easy. So welcome to NSK handpieces, titanium handpieces, because they fit the bill of all of these. What am I looking for in an electric? First things first, I'm looking for torque. I am looking for a prescribed amount of torque, because when you apply an air-driven handpiece with a burr and a tooth, and it's not a brand new handpiece, those RPMs immediately decrease and sometimes even stop on tooth contact. I know some of you are laughing, because some of you have those handpieces in the office. Yeah, you'll get you through a class too, but the minute you put that diamond, in order to do a proximal slice, that burr will stop right in that air-driven handpiece. As you apply more pressure, if you can get these things going, your accuracy goes down. Electrics immediately overcome this with consistent torque. We look for concentricity. Most air-driven handpieces have ball bearings in the head, which are susceptible to wear. As they wear, their burr becomes less concentric and begins to wobble, giving us that chatter. We've all seen it. Some of us will probably have those in the office right now. If you have them right now, send them out for repair while you're still not working or not seeing as many patients. With electrics, the way the gear design is, it allows for superior concentric movement, and we will not get that burr chatter in the head of the handpiece. Everybody loves power. Everybody loves power. Power is what things are all about. And the beautiful thing about electrics is that you can actually dial down the power, especially when using electric low speeds or doing some real precision work, as opposed to a high speed, stepping on the pedal and then just going with the handpiece. When I'm excavating deep decay, like this infected dentin, I'm going to use a specific armamentarium. I'm going to turn off the water spray. I'm going to have my high-speed suction sitting right here by the side of the tooth. And with light strokes at 6,000 to 10,000 RPMs, I'm going to remove all this decay. Now, what does that do for me by having the light strokes at 6,000 to 10,000 RPMs? Number one, I have probably the most critical aspect. I have tactile sensation. I really could feel myself peeling away that decay. Two, I have control, because what's going to happen here is we're going to get closer to the pulp very, very quickly, and I want to have ideal control. So using my NSK NLZ electrics, I have, and I'll talk to you about the NLZs in a few minutes, I have the ability to dial down that handpiece that I can get really close to the nerve, like in a situation here, yet not expose the nerve, because I was real gentle in dialing down that handpiece. The other thing that I can do is I can turn the handpiece up, put my beveling diamond on, and bevel the cavo surface margin here, again with virtually no aerosol. It's a quick bevel. So two procedures in this large class two. One, excavating the decay with a round burr and a slow speed, and now replacing it with the high speed and placing my bevel here at somewhere around 30,000 RPMs with no water. The NSKs electric are critical for me when excavating decay in areas that are very sensitive. So this patient had some decay under a veneer. You see the little divot right there. And here I used what's called the Comet or the Comet ceramic round burr. These are ceramic round burrs that stay really, really sharp. They're called cereburs. And we use them here in the slow speed at around 8,000 RPMs. And I want to use this at low RPMs for two reasons. One, tactile touch sensation, of course. So 8,000 to 10,000 RPMs. But two, I don't want to damage the porcelain. So I got to be dancing around the porcelain here, and 8,000 to 10,000 RPMs is going to be somewhere around the right number. I'm also able to kind of slip this right beneath that margin and excavate that decay. And I'm doing this with basically no aerosol. There's no water spray here, so I'm not going to have any kind of aerosol. I'm dialed down the power. I'll have my suction tip right here at the top, but I'm not going to have any kind of aerosol. So I will not be creating aerosol other than a little bit of dentinal dust that my assistant will clearly suction up. We'll excavate all our decay. We'll place a 37% phosphoric acid etch, etching the dentin and the porcelain. I will place my adhesive in place. And then this is a cool little instrument from Clinician's Choice. It's an aesthetic contouring instrument. It's a bendable aesthetic contouring instrument. It allows some complete control in getting in and around line angles. So as I get here to this outside, I can kind of run this right around and get in between the teeth and scoop out any flesh. Here, restoration's cured, and I'm polishing with a clinician's choice polisher, and I'm cutting down the RPMs once again, 12 to 15,000 RPMs, light pressure and no water. So I've eliminated aerosol again. Sometimes what I'll do is just take a drop of water and wet the restoration. But while I'm using this at 12 to 15,000 RPMs with my NSK electrics, I am not creating that aerosol. And that's the beautiful thing about the NSK electrics, and that I can dial that down. So if I have some gingival flash, I can take a fine beveling diamond and raise the RPMs to 18 to 20,000 and remove it subgingivally without water or a low amount of water and suction. And it's a very, very quick procedure. So if I need to do that, a red stripe beveling diamond just running around the margin, a little bit of water, so little to no water, because the goal here is to reduce aerosol. These are those center bursts and comet. It works well on soft carious dentin with minimized reduction of sound tooth structure. Now, don't get me wrong. Use this burr at 40,000 RPMs on a hard dentin, you'll cut it. It's a sharp burr. So the goal here is to reduce the RPMs at the same time when using the center burr. Very important. Let's talk crown preparations. You know, it seems so simple, but at the end of the day, it's difficult, and some will contend it's one of the most difficult things we do in dentistry. So how do you get those types of preparations? Let me take you back one. Smooth preparations the whole way around. You need access to a few different types of burrs, and you have to be able to control the RPMs in the water. You can get preparations glass smooth like this. And I want to thank Dr. Frankie Schull for lending me this slide a good number of years ago. How do we get preparations like this? Well, initially, we're going to do our preparation with a coarse chamfer diamond, 40,000 RPMs. We're going to need some water spray. We're doing a bulk of tooth reduction. Once I'm done, I'm going to dial down the high speed to 20,000 RPMs for smoothing. I will have an aerosol spray, but I'll turn that down probably by about 50%. Once I've smoothed everything off, and I want to finalize this margin to get rid of the lip and drop things down, I'll use an end cutting diamond for final adjusting of margins with a light water spray. So I have to use some water spray here, but the only time I have to go full blast on my water spray is when I'm doing my complete preparations. My complete preparations at 40,000 RPMs with a water spray are going to be critical for not heating the tooth. Now realize when using the electrics, the beautiful thing about power and torque is I lean that burr in and I go. I'm not going to paint the finish line or paint the top. I lean the burr in and I go. Let me kind of show you what I mean when we talk about final finish of the margin with those little burrs. This is a burr, and a few of the manufacturers make them. Comet makes one, Microcopy makes one. It's a burr, you see no diamonds on the shank. We just have diamonds right here at the bottom. And eliminates the potential lip that you may end up with a chamfer, and I'll show you how I use that in a second. So I'm going to play this video. These are crown preps there. The margins have been lasered. And I'm going to go ahead and take my margin lowering diamond, if you will, the end cutting diamond, and just show you how I drop the margins on these. So this is the 18,000 RPMs. It's a Microcopy end cutting diamond burr. This is pre-COVID, obviously, but you See this, some aerosol? But we're going to smooth the margin off and drop it to the ideal position that we're looking to drop it. We don't want to have a lip, especially if we're scanning, but definitely not an impression. And we want to go ahead and create that reduction. The tissue looks like that because we lasered the tissue already. And we're making the margin meet the laser tissue. You'll see it here on the lateral once again. Light strokes, painting, finishing that margin, getting that margin into an ideal position. And you can kind of see how glass smooth those preparations are already. And if I could do these, you could do these. It's just taking the time to get those procedures done. So there's a lot of wear and tear on air turbines. So if I'm going to go ahead and prep 5 or 6 teeth, and I'm putting extra pressure, I'm going to start blowing out turbines. And then we know as they wear, the handpiece becomes ineffective in power needed situations. What gives you the most wear and tear? Well, precision removal of crown and bridge. That's going to give you the most wear and tear on an air-driven turbine. I mean, the goal there is you want to slot these and get them done. So for those that don't know, or I don't know how all of you do these, and again, some of the things that I always talk about that are obvious to me may not be obvious to others. We'll take a diamond, cut here to the metal, then take a sharp 330 burr and cut right through here and use a separating tool to separate these, creating atraumatic removal of crowns. Now, when you're cutting off zirconia, that's where it gets a little bit tricky because zirconia is hard. So here, contrary to popular belief, you want to use a fine or an extra fine diamond or a carbide that has been dedicated as a zirconia cutter. Do this enough in an air-driven handpiece, even the best of them, you could ruin them. It will not happen with the NLZ electrics. These are a couple of different burrs. People ask all the time, what do you use to remove zirconia crowns? Here's just a few of them. Comet has a great burr called the 4ZR. Premier's got a burr called the Z-Tech diamond, a double orange striped diamond. And Microcopy has a zirconia cutter as well. So all of these reputable companies have a great burr that can be used to remove zirconia. So again, this may be basic to some, but this is just removing a crown where I'm going to slice through here with our electrics. Now notice I lean right in. I'm not painting, I'm just burying it in there, and that burr doesn't stop. So once again, I'm going to start it, and we're going to lean right in. That burr is not going to stop. You may hear the torque on there, and it'll even get through the metal in certain spots before I put a 330 burr on. Now I'll take my 330 and just cut through, and it's a very easy cut through because it's a new burr, and this will have consistent torque at 40,000 RPMs. Notice you can see here, I'm not putting a lot of pressure on the 330 burr because the burr is sharp and the handpiece is really powerful. And now we'll just twist these off and they will come off atraumatically. What happens when you got to remove a zirconia or lithium disilicate crown? You got to cut them in a few different spots, section them, section this piece usually very often as well, clean the preparation. So 2 ways to get this extra piece off. One is, if you go ahead and refine the finish line and lean into this with your electrics, very often this extra piece will just pop off the lingual. Otherwise, you got to section it right here on the occlusal and give it a twist and it'll come off piece by piece. You know the rule of thumb, when you're rushing, you're gonna have to section this off into 40,000 little pieces. When you have a lot of time, you'll hit this and it'll pop right off, just the way it works in dentistry. Crown comes off, we clean everything up, remove the cement. We're gonna leave some slots here as just short prep. And we can clean everything up very, very easily. And then replace it with an aesthetic monolithic zirconia crown. I told you, you heard me say the term NLZ. NLZ. What's NLZ? NLZ is NSK's electric handpiece system. This is the size of the motor. As I call it, it walks tiny, but carries a big stick. It's tiny, it's small, but it can be mounted anywhere. And it's got many important functions in this little box. So the beautiful thing is, it can be mounted anywhere with the box being here. Look, it's so inconspicuous here on the tray. Or it can be mounted here at the side of the tray. It can be mounted under the tray. It can be mounted almost everywhere. It's got a variety of different options. I'll take you back one. It's got a memory button, so you can put in multiple different settings. I can adjust the LEDs from this if I will. It's got the ability for you to do not just endo, but also rotary endo with the proper handpiece with the same motor. It also has a specific check and balance system called ContraCheck. The ContraCheck, when you run it, will tell you if everything's okay, or if something is not okay, it'll tell you what's not okay with it. So why NSK handpieces? They're lighter. There's a shorter head with a smaller diameter. It is fairly quiet for a handpiece. It's not going to heat up all that often. All of these are distinct advantages to NSK. If you keep them the way we keep them, because people ask all the time, you're doing a lot of crown and bridge, do these things last? Well, all our handpieces go through the eye care system. Now, if you don't have NSKs and you want something like this, they have attachments for anybody else's handpiece. But this is a system that will clean and lubricate handpiece with a preset solution volume based on handpiece type. It'll purge everything, and it will keep your handpieces healthy for a very long period of time. So you could totally not only clean the handpiece, but you can also clean the chuck. So you kind of clean it from both ends. So that's the beautiful thing about the eye care. And it'll take any of the handpieces. Whatever you got, it'll fit, or we'll get an adapter to fit. One last thing I want to say about electrics, I'm going to get the question and answer, is they're less noisy than air-driven handpieces. And both the doctor and the patient can truly appreciate the difference. Now, many of you, I know I for one, 28 years into this, I have some mild hearing loss in one ear. And I think that's quite common with dentists. Many dentists now have resorted to wearing earplugs when they work. And it may seem funny or look funny, but it's smart. But if you have electrics and the decibels are lower, then you can totally not have to necessarily wear those earplugs, but also feel much more comfortable with what you do. I knew there'd be a lot of questions, so, and I see that there are, and I'm going to get to them. So I timed it to end about 9 or 10 minutes early, which we're going to be right around time. I think there's some important takeaways from tonight's webinar, and I think any webinar you take now, the message should be clear for all of you. Number one, when you go back to practice, don't be apprehensive. If you're apprehensive, you're going to make a mistake and you're going to get in trouble. We have been using universal precautions forever. I can make a case that we're the safest place as far as a doctor's office to be at. So don't be apprehensive going back to work. Use your universal precautions. At the end of the day, you can use everything and you can still get COVID-19. So you have a choice. Don't go back to work or go back to work. And most of us are going to go back to work. Some of us, in our 70s, may choose not to, and that's okay. You've done this for a long time, you don't want to go back, that's fine. But don't go back being apprehensive. Use your universal precautions. You need some luck on your side, and just practice a little smarter. Adding things like electrics can totally change the way you practice going forward. So with that, again, friend me on Instagram at Vino Dentino. Tomorrow night, my shameless plug, 7 p.m. on my Facebook Live. We're going to be interviewing a famous winemaker from Napa Valley. Artie is a brilliant guy and some great insight, so you could enjoy that. And now let me get to my question and answers. Let's see where we are. I'm going to back up one. Here we go. Okay. So the first question was about the air scrubber with the UV light. Could this be cancer causing? The answer is no. Everything is buried up into the ducts, and it's not a power of what it can cause cancer. It's just treating the air as it's passing through the ducts. It's not in your open space. These HEPA filters aren't made for aerosols. I heard dentists who have bought them, leave them for 24 hours a day. In theory, some HEPA filters can filter down to 0.1 micron, which that's what COVID is. I'm not a huge believer that these are the answer. I would say if you treat your space and you put some backup filters in your office for optics, as I call it, so patients see something is there, that's okay. But I'd be careful relying. There's some good companies out there. Look at Surgically Clean Air if you like these kind of things. It's a company, but I hesitated. So Whitney not only asked me a question as a hygienist. I'm a hygienist and I think this is great, but I doubt patients will be willing to have this used on them. I don't know what you're talking about. Maybe you're talking about suction, but we've tried it on a few on ourselves. If you're talking about that retractor with suction in it, we've tried it and it was actually fairly comfortable. Whitney, tune in next week. I'm going to give you some more tips on the hygiene side. I just didn't want to give them all away tonight. So just wondering where the 21-day recommendation came from when most places ask past 14 days. So Amanda, the 21 days came from doing enough reading and seeing anecdotally that people have presented to me 21 days post-op, still positive from COVID. I would definitely not treat somebody 14 days post. I almost bet they're shedding virus. I would strongly hesitate doing that. Monica, I must admit disclosure at the beginning. There was a disclosure. NSK is sponsoring the course. Why not use peroxide in your scaler, Dr. Scott? I didn't say I wasn't, but I'm talking about scalers next week, so I didn't discuss it tonight. Are there copper parts in the handpiece that will corrode from hydrogen peroxide? The answer is I know my NSKs should not. I think you need to speak to your manufacturer if you'll have any problems with peroxide. Let's see. Can you also have children rinse with peroxide, use the gel to brush? Absolutely, you can. Monica, I thought the virus is coming from the lungs. How would Permatex work for that? So, Monica, there is and I don't know if you've seen, Rutgers recently released a salivary COVID test, and Microgen DX is a salivary test, and there is a belief that the first place the virus embeds is in the walls of the cheeks and in the back of the pharynx in the mouth. So we're seeing it in saliva. So if there's any, if there's anything that is in the mouth, any type of peroxide or periprotect will help. When leaning on the crown preps, don't you damage the pulp? Do you often need to do root canals after? Dr. Carlin, no, we really don't damage the pulp at all. I'm using water. I did say aerosol. And again, don't forget I have consistent torque with my electrics. I'm not applying torque starting, stopping, starting, stopping, starting, stopping. So really don't do a lot of endo. And the cut is very quickly, so the contact time is really much less. Thank you for the nice comments. What happens when removing a bonded zirconia crown? Really the same thing. If you're removing a bonded zirconia crown, if you use those burrs, any one of the 3 burrs that I mentioned, if you use those burrs, then you'll get those off, especially with an electric handpiece. Can I please repeat what percentage of hydrogen peroxide do you put in your line or bottle? I don't know if it's safe for other handpiece, Donna, and basically what I'm doing is I'm taking the 3% hydrogen peroxide you can buy in a drugstore, and I'm diluting it 1 part peroxide and 2 parts water. And that's what we're using in there. So Shayla asked me, what do I think about the extra oral dental suction? You know, is it worth investing? And thanks for the nice comments, Shayla. You know, I think everyone's got to do what makes them feel comfortable. I believe that that is a piece of equipment that for now people are buying and in 6 to 9 months will likely never use again. I think there's some good products out there. There's a company called Surgically Clean Air, SCA. You could look at that if you want that kind of a product. I am not doing that because it's going to be hard enough to work with all the new PPE that I don't know that I could work with something sitting right in front of my patient's mouth. And then the question becomes is, how much more is that actually grabbing? Yes, it's grabbing more, but how much more? And is that clinically significant? So Samira asks, will Isolite help reduce aerosols? Isolite is a phenomenal product. If you use it, Isolite, go for it, it's great. What is the cost on electric handpieces, Matt? Nasreen asked me the same question. I honestly don't know. You know, I would say right now, I'd be willing to bet your dental supplier is probably offering great deals. Look at suppliers who are very aggressive, like Midway Dental Supply out of the Midwest, or maybe Benco, and see who's offering you great, you know, solid deals. And I think when it comes to electrics with all these types of situations, the more you buy, the better the deal it is. So someone said they lost their hearing too. I'm wondering if there are any studies and articles to show. If you do a PubMed about hearing loss and dental high speeds, I'm sure you'll find plenty. What is my plan with masks as acquiring N95 and even 3 cannot be had? So Michael, you can get N95s today and you can get level 3s, maybe, maybe not. I do have a bunch of N95s in the office. There are a number of dental supply companies you can get them from. For sure, I know Midway has KN95s. There is a woman up in Buffalo that I was getting N95s from last week that if I look at my phone, I could try to give you a phone number for if you're interested, if she still has them. They're hard to wear. That's the biggest problem, I think. And the issue with wearing these types of masks are it's not easy. So the gal's name in Buffalo is Becky Colville. Her phone number is 716-907-6945, 716-907-6945. She works for Gordon Companies. Gordon Companies is actually the largest Christmas ornament seller in the United States and switched to selling PPE during this time because of their contacts in China. I bought N95s and KN95s. The N95s I think were $6.50 a mask. The KNs were $4 a mask, but I bought a bunch to have now. Vinay, what is the end cutting burr you mentioned? The end cutting burr, Comet's got it, and Microcopy, just look for end cutting diamond. You'll see it. Lillian, nice to see you on here. The concept of electrolyzed salt water, hypochlorous acid. It does apply to my topic tonight. I didn't include it because most people don't have it. We've been using hypochlorous acid for 15 years. Hypochlorous acid is electrolyzed water and it kills everything under the sun in a couple of minutes. It's FDA approved as a waterline disinfectant, a countertop disinfectant, as well as a oral irrigant for endo, perio, and surgery. There's a company called Ecolox, ECCOLOX, I believe, that sells a device to make electrolyzed water. It's great. The only thing you have to know, it will ruin stainless steel and handpieces. Do not put this in your water bottles. You can use it to wipe things down, which is what we're going to use in our office, but do not put them in your bottles. You can put them in your suction lines because that's what it was brought into dentistry for originally, but do not, if it comes in contact with stainless steel and it sits for more than 5 minutes, you will corrode it. We have NSK electric handpieces. There's one that helicopters. What do I think happened, Paolo? I'm not sure, but if you send it to NSK, their customer service is second to none. By the way, most of their products have 3-year warranties on them, which is another unsurpassed, and don't quote me on that, but I think that's correct. It's unsurpassed in the industry. So I'm going to pick a couple of more because we're going to be in the overtime. Can we use the NSK electric with your Wave 1 motor? You'd have to ask your NSK rep. I'm not sure. So Mark asked me, when do I use air-driven handpiece, if at all? Nah, I just give it to my associates. I'm joking. I really do give it to my associates. Once you go electrics, it's so hard. I have a bunch of NSKs. I mean, if I don't have an electric out of the autoclave, I'll use my air-driven, but otherwise my option is electric all the way. Where do you get an aerosol scrubber? You get that from your HVAC guy. Look up the company. It's called Aerus, A-E-R-U-S. Thank you, thank you, thank you. I appreciate you guys. So Lillian, thanks for the nice comments. I'm going to get to this last one right now because the hygienist asked me a question. I'm working with a dentist as a hygienist 14 years. He never wore a mask. How do you see him using an N95? And he is saying how it's safe to come back. He was in the office on a Friday, did not see patients, walked around the office with no mask. How do you feel safe coming back? It's a very hard thing. I can't tell other people what to do, Ludmila. I think that presenting him with some research and telling him how serious the virus is may convince him. Dentists have to wear masks. I mean, it's part of OSHA. And I would just say to you that if you don't feel comfortable, then you should just not go back to work. I mean, that's really the bottom line. The most important thing for me was to make my team feel comfortable. Carla, I'm happy you love your NSKs. Thank you. Everybody come check me out next week. And we're going to talk hygiene. NSK is sponsoring that one too. I'm going to show you some real cool concepts on hygiene, and we'll talk a lot about piezo. So thank you. I'm going to pass the buck back to the people at Viva Learning.